From the point of view of clinicians, we get a bit disheartened when we still can't really help people to achieve what they want to achieve. So we need to find something. Doing the same thing is only producing the same results. This feels like a really positive step that we could take to make a difference. And if it makes a difference to patients, it will clearly make a difference to the practice and to the clinicians.
As a practice, we've got quite a lot of work pressure at the moment, and we find that we're seeing the same type of patient again and again, but without the reward of properly sorting them out because of time pressure, whether that's consultation time, admin time, anything. So we're looking for a more efficient way and a more enjoyable, rewarding way of trying to treat a certain type of patient.
So I think it depends on the application of the group consultations. A lot of them are long-term conditions which are generally managed by our nursing team, but equally they're also a precious resource. So I think a lot of this will be run in certainly my practice with a specialist nurse team, perhaps with physicians associates, social prescribers, pharmacists. But I think it also gives variety, and for general practice a lot of we do know that burnout causes from overwork and doing a lot of repetition. Being part of a team, working in group consultations, I think creates variety in the working week and a new new flavour to your job.
As doctors, we don't tend to get much time together either during the day. We find we're very much stuck in our room, just seeing patients one after the other. So I think it's nice to get out and have a bit more of an inclusive group feel. So I think it'll benefit us and them.
I'm sure that the potential for patients is to feel that there are other people who have the same questions and have the same similar problems to them, and that by sharing their stories they can come up with solutions that they wouldn't find on their own. Feel less isolated. A lot of people feel with diabetes or COPD it's their fault and they're a failure. To have other friends, that can really help them feel empowered and energised to do something about it.
I think the clinicians will definitely benefit. I think the ones who are implementing the group consultations will get more satisfaction out of their job, but also feel like they're sorting patients out properly. I think it will have a direct impact on the clinicians who aren't involved in the group consultation also, because it will free up acute appointments. It means that appointments aren't taken up by less urgent things like medication reviews or diabetic reviews, and it's something you can do as a group. So I think as a whole it will benefit everyone, and that will create more time for admin. We've got loads of admin at the moment, more than ever as a profession now, so it means you've got time to do that and you're not trying to cram it in at the end of the day and leaving late.
Well, the wider health service, obviously the impact should be if more people feel enabled to take more care of their own health. One, they'll be spreading the stories, and people are much better at spreading the stories amongst each other than listening to nurses or doctors. But the other thing is it should reduce admissions, it should reduce costs, because people are looking after themselves a bit more, and people are actually making their own health networks, which are probably a great deal better than bossy health leaflets, I think.
But it also, from our experience and from the experience presented today, it also is a cost-effective way of delivering healthcare and enabling a lot more people to take control of their lives. And we know from a social prescribing audit that was done from the University of Huddersfield recently, they showed a 20% reduction in GP attendances for those who had input from social prescribers with long-term conditions. So we do appreciate that helping people with their social situation improves their health.